Cincinnati Children's Extracorporeal Life Support Program was established in 1985 and was one of the first 15 centers in this country. We are also members of the Extracorporeal Life Support Organization, which allows us to network with ECMO centers from around the world. Our center is consistently recognized as a center of excellence by this organization. ECMO stands for Extracorporeal Membrane Oxygenation. Extracorporeal means that the blood circulates outside of the body with the help of a machine that acts as an artificial heart. Membrane oxygenation is the use of an artificial lung that puts oxygen into the blood and takes out carbon dioxide or CO2. In simplest terms, blood is removed from the body, oxygen is added, and carbon dioxide is removed. The oxygen-rich blood is then returned to the body. ECMO is used when the lungs or heart are no longer able to support the needs of the body. The machine takes over the work of the lungs and the heart, giving your child's body time to rest and recover. ECMO can help patients with a variety of medical problems and conditions, including pneumonia, congenital lung and heart conditions, reversible respiratory or heart failure, as a bridge to long-term heart support, or as a way to return blood flow to the body when the heart has stopped and CPR is required. There are two different methods of doing ECMO. Veno-arterial, or VA ECMO, removes blood as it enters the heart and returns the oxygen-rich blood to the aorta, the large blood vessel that carries blood to the rest of the body. This type of ECMO allows both the heart and lungs to rest. The second method of ECMO is called veno-venous, or VV ECMO. In this method, blood is still removed as it enters the heart, but the oxygen-rich blood from the ECMO machine is returned to the exact same place where blood enters the heart. The blood is then pumped throughout the body by the patient's own heart. This type of ECMO allows for the lungs to rest and recover. ECMO is performed in our intensive care units on newborns through adults.
Each child is placed on ECMO for very different reasons. Depending on that reason, your child could need ECMO for a few hours to several weeks. The average time on ECMO is 3 to 14 days. Your child will be able to come off ECMO when the heart and lungs recover enough to be supported with more common conventional therapy. When the ECMO catheters are placed, your child is given medication for pain and sedation. Your child will continue to receive these medications while on ECMO to keep them from being in any pain or discomfort. Most children are given medication to keep them asleep and comfortable while their body heals. During this time, your child most likely will not be able to respond to you. Some children will be awake and able to do quiet activities in bed, but will still be quite drowsy most of the time. Parents and guardians are very important to their child's care and recovery. There are some things you can do to help with your child's care. Please ask your child's nurse or ECMO specialist how you can participate in their care. Some examples include gentle touches and calming voices to provide comfort. You can read a story or sing to your child.
I think the important thing to remember is that you don't have to be afraid to get up close and make sure that your child knows that you're there for them. It's important for them to know that you're there, and you don't have to be afraid of all the pieces and the equipment and the tubes to actually get in there and just let them know that you're there with them.
It is also very important that you take care of yourself as well by eating properly and getting rest. In addition to the team that has been caring for your child, surgeons and a team of caregivers who specialize in caring for children on ECMO will work together to provide the care for your child. An ECMO specialist stays with your child at all times while they are on ECMO.
Please feel free to ask any member of your child's care team any questions you may have. You are an important part in the healing process.